So we pinpointed a specific stressor that was contributing to a lot of my patients' neurological symptoms. She came in and she started experiencing nerve pains and zinging and almost tingling down her arms. She started experiencing headaches and sometimes migraines that would last for a few days. She had some dizziness, she had fatigue and some forgetfulness even, and she's only in her mid-20s. So we did a neurological exam. Everything looked normal. We did an x-ray. We obviously looked at her atlas bone, her upper cervical spine, got her adjusted. She started to feel better actually, but the symptoms persisted. So check out what we found with her labs as we dove deeper. So this patient started describing to me that her environment that she works in has mold all over the place, in the walls, in the vents, and when we tested her for a mold toxicity test, she tested positive for 3 different strains, 2 specifically being neurotoxins and carcinogens, and just putting stress on her kidneys and contributing to a lot of the symptoms that she was having. And when we pinpointed exactly how high these mycotoxins were in her body, she tested for these 3. I was shocked when I saw ochratoxin this high. Glio and citrinin as well are known to disrupt the nervous system and cause a lot of those symptoms, believe it or not. So I wanted to pull up some insight for you guys to understand that mycotoxins, as we know, are known to damage the immune system directly by disrupting CD4 and CD8 cells and lowering natural killer cells. Do you guys know how important those are, especially for cancer? And we can see, obviously, being exposed to these for too long declines the body's immune system health. But further along, specifically ochratoxin is known to cause neurotoxicity, as well as contribute to some depressive and cognitive deficits, and contribute to oxidative stress and cell death. Can you believe that? And it's also known to be correlated with Alzheimer's and Parkinson's even. So moral of the story is we discovered that these were big drivers for the inflammation, not only to her immune system and her gut, but also her nervous system. So we got her on a plan to help fix this, to help her get out of the environment that she was in. So she was able to leave her work, and we've been trying to detox the mold out of her body, working in sauna, working the appropriate nutrition, supporting those detox pathways accordingly, and she's already seeing some improvement. So make sure that you are getting a mold toxicity test, especially if you have any neurological symptoms, chronic fatigue syndrome, and even Hashimoto's autoimmune especially.